Today is June 7th, 2019, and this is Cheryl. Hi, Cheryl.
Hello.
Cheryl, we are just doing a follow-up video for Cheryl. She came in July of 2018 with a knee complaint, fairly significant knee pain. Cheryl, could we just briefly recap that, and then I'd like to just do a follow-up video as to where you've been now that it's almost a year later since you initially came in the office. So,
Sure.
Initially came in last year, you were having a lot of trouble with the knee, correct?
Yes, very much so.
So, would you like to just share a little bit how uncomfortable it was?
It was very uncomfortable. I seriously couldn't hardly walk. I remember coming in here and trying to walk, and it was very difficult.
So
It was
you're
very painful.
You're painful, and so on a scale of 0 to 10, 10 was excruciating, 0 it didn't hurt. At the time that you came into the office last July, what level of pain did you have?
Well, I remember I said about a 7, but it was probably a 7 to a 9, actually.
And what was the most difficult activity that you were having?
I couldn't really do life. I couldn't walk. I couldn't, go up and down the stairs very easily. When I came in, I was basically elevating it pretty much all day long.
You couldn't go for walks with the dog. I remember you
all.
telling me you basically had to stop your activities just because of the degree of discomfort.
Yeah, I remember that. And also just driving in the car or riding in the car if my husband was driving was extremely painful.
Yes. So you came in, we examined it, which again, almost a year ago, and we've now had almost 11 months later. Where is your knee at? How well has it maintained itself? What type of trouble, if any, have you had, or have you had any trouble, or what's happened?
It's truly amazing. It really is. I would say almost 100%, but of course, nothing being 100%. Every once in a while, I might have a little discomfort, and then I just know to, slow down a little bit and take it easy. So I would say probably realistically 95% to 98% better.
So you're able to walk and you're able to
Absolutely.
do your activities?
I don't even think about it.
Now, didn't you mention to me not long ago you were even on a ladder and you were on ladders? Is that
Yeah,
true?
I was. I was painting the eaves of my house.
Would you
Yeah.
had ever considered painting the eaves of your house a year ago this
I
time?
couldn't. I wouldn't. No.
You wouldn't have dared?
No. In fact, even just doing regular housework, of course, I had to do it, but it was so painful even to put dishes in the dishwasher. Like you have to do it, but
Right.
it was so painful. So no, I would have never been up on a ladder.
Okay. When I heard that, I knew that was really positive that you were tackling the eaves of your house and painting on a ladder.
Yes.
Now, I wasn't excited about it, but
I remember
I was
that.
still impressed. Do you mind if I just briefly show your knee x-rays just so we can show the damage? So is that okay with you?
That's okay with me.
Okay. So here is Cheryl's knee joint, and you can see there's the right knee, and you can see the medial compartment near where the arrow is shows the loss of spacing between the two bones as compared to the outer lateral aspect of that joint, meaning right here, good spacing. Right in here, you can see the spacing is narrowed. There's a little bone spur right here. And similarly on the left knee, there was also loss of spacing at that medial compartment. So, Cheryl, 95 to 98%, and that's a significant change. Do you have, again, any advice for future patients who might be suffering from a knee complaint, really wondering if this is a reasonable option? What would you say to them? I'm just curious.
I would say absolutely try it. Absolutely.
The treatment process for you was about 3 months, right? 3-4 months?
It was 2 months, 3 times a week, and
Yes.
then the last month it was twice a week.
Yes. And how difficult was that treatment process for you?
Well, in the beginning, it was difficult, but
Because of the discomfort?
the discomfort, yeah, and but seriously, it started feeling better after that first month. I could start seeing the progress, and it's worth it.
And you
I
were
know it's a lot for people, but it's worth it.
you were traveling from Lake City, Minnesota, which was about a half an hour from Red Wing.
Yeah, about that.
Yeah. And so you just made the commitment, and in the grace of God, that healed well. So I'm super happy for you. Do I have your permission to share this story with doctors, students, or patients anywhere?
Absolutely.
Any restrictions on that?
None at all.
Cheryl, super happy for you, your knee, and your ladder climbing. Please don't overdo that. And we're excited for the knee. Stay active, stay busy, keep moving. That's the key, right?
Amen. That's
Yes.
right.
Thanks so much, Cheryl. God bless you.
God bless you, Dr. Sevlie.